What kind of treatment is used within therapy?
So there's cognitive behavioral therapy provides some relief, and cognitive behavioral therapy is how you think and how you behave, and it's research and evidence-based. Very, very practical therapy of just going through what you think and whether it's true and how you feel about those things. That's really profitable, and like I said, it's evidence-based. The other type of therapy might be somatic therapy, where you realize the autonomic nervous system has been impacted by the trauma, and a therapist who is experienced in that can walk you through that process. And then the therapy that I'm most accustomed to is eye movement desensitization and reprocessing therapy, which is also referred to as EMDR.
Kate, can you explain EMDR and how it's beneficial to anybody who's been impacted by trauma?
EMDR has been used to reprocess the trauma so the person thinks differently about the trauma and they think differently about their role in the trauma. It also is used to take away the long-lasting effects of the trauma that show the hypervigilance, the hyperarousal, the avoidance, and
some of those nightmares and
flashbacks.
the
nightmares and the flashbacks,
which is huge and beneficial for anybody who's
right
seeking help in that. Do you think that a lay counselor or someone not qualified specifically with trauma work is beneficial, or do you think a person maybe watching this video should seek out someone who's trained in trauma work?
I think I'm biased in that a person should seek out someone who is trained in trauma work, and if they have a lay counselor communicating with their professional counselor, that can give them the support to keep going through those really tough parts of the professional counseling. But yeah, I think that a professional therapist who's trained in trauma work can watch for those nuances so that they can slow down the process when the client is showing resistance.
Mm-hmm.
They can slow it down, or they can say, okay, let's go through this, and they can watch for those nuances that show the person might be going into major depression.
What about, I know that a lot of people watching this have, unfortunately, walked in and found the body of their loved one after suicide, which is so traumatic and devastating.
Mm-hmm.
And so it makes sense that they would experience trauma and PTSD.
Right.
But I also know that other people who have not found bodies have been impacted by PTSD. Can you talk about how that works?
Actually, research shows that you can have compassion post-traumatic stress disorder. So I can hear about a traumatic event and have compassion fatigue, where you're telling the story of what you saw, and I can have that image I can create that image in my brain and have post-traumatic stress disorder because of that, or just traumatic, maybe not fall into the line of post-traumatic stress disorder, but have nightmares and intrusive thoughts about that.
Yeah, I also know that some people have been impacted by PTSD where they replay over and over again the time where they picked up the phone and they learned of their loved one's death.
Yeah.
They're being told it, and so that's
Absolutely.
their trauma.
Absolutely. You can remember, a lot of times people can remember specifically where they were standing,
Mm-hmm.
specifically where they were, what the time of the year was, and all of that.
And conversations leading up to that phone ringing, or
Mm-hmm. In fact, what research also shows is that it's not good to just continually repeat that story of the traumatic event, because what we don't realize that we're doing when we're repeating the story, we're actually reinforcing the trauma in our nervous system. So that's why it's really important to be with a quality trauma therapist who you can tell that story to one time or two times, or maybe up to 3 or 4 times, but they're helping you reprocess each part of that event so that you Don't hold it in your nervous system.
That's interesting.